I'm Anne Hollins. I'm the Director of the Australian Institute of Family Studies. And on the screen, I think, as well as me, you're already seeing Maree Brown. I'll introduce her to you shortly. I'm here on the lands of the Wurundjeri people of the Kulin Nations, and I pay my respect to their elders past and present, and to those of all the lands on which you're joining us from here in Australia, New Zealand and elsewhere. The Families in Focus webinar series grew out of the pandemic. We had to reschedule our conference to June 2021 and decided it was a great opportunity instead to invite some of our keynote speakers to present this year, in June this year, when the conference should have been happening, but via webinar. By the way, registrations for our conference in June next year are already open via the AFES website. So today I'm delighted to introduce to you Maree Brown from Wellington in New Zealand. Maree Brown is Director of the Child Wellbeing Unit, New Zealand Prime Minister and Cabinet, which is leading cross-sector work on New Zealand's first child and youth wellbeing strategy. Prior to her current role, Maree held senior positions in Oranga Tamariki, the Ministry for Children, the Ministry for Social Development and the Ministry for Culture and Heritage. Maree spent most of her career in child and family policy roles. Maree will tell us about progress on New Zealand's child and youth wellbeing strategy in the current COVID-19 context. So to everyone listening, please start posting your questions for Maree in the questions field now. Anytime you go on the GoToWebinar platform. My advice would be to try and keep your questions short and concise. It makes it a bit easier for us to read them as we go. You can also head to the handouts section on the site for the notes that Maree has provided. So welcome, Maree.
Thank you.
Hope you're well over there in Wellington.
Very well, thank you. Although I did just hear we just in the last half hour we've had 2 more cases of COVID, having had 24 days without any community transmission. So a bit of a setback in the last hour. But,
yes,
apparently, some people have arrived in from overseas and got a dispensation to go to a funeral. So yes, I think there's a news conference as we speak, in fact.
Oh, goodness, yes. Well, we've had a few more in the last few days as well. So I guess this whole situation is just, it shows that it isn't over, that we've in fact got a long way ahead, both in terms of the social impacts as well as the economic impacts of this health pandemic. So we're all in the same boat when it comes to this. So, Maree, I'm going to start by asking you very simply, what is the New Zealand Child and Youth Wellbeing Strategy?
Okay, well, first of all, hello everyone. Kia ora koutou, ngā mihi kia koutou. It's really lovely to be part of this series of webinars, and I'm sorry I couldn't be with you in person for a conference, but we look forward to that next year. So the strategy, up on your screens you should have our plan on a page, and effectively the strategy is a plan. It's New Zealand's plan to improve the well-being of all children and young people in New Zealand. What it sets out to do is to put in one place everything that's important for children and young people to have a good life, what we heard was important to them, what government's doing about it, the outcomes that government's trying to achieve and the plans and policies it's putting in place to help achieve those outcomes. And also it gives some ideas of what other sectors can do as well. It has a legislative base. It comes from some work that was done very early in the term of this government. The Prime Minister made herself Minister responsible for child poverty reduction, and the government introduced some legislation into the House within 100 days of coming into power. That was legislation that would require all successive governments to identify child poverty targets and report against those targets. But also all governments, this government and beyond, would be required to develop and implement a child and youth wellbeing framework, a strategy that would seek to improve the wellbeing of all children and young people, but with a particular focus on 3 groups: those children with greater needs, those in poverty or experiencing the effects of socioeconomic disadvantage, and those of interest or concern to Oranga Tamariki. That's our Care and Protection and Youth Justice Agency. So even in the legislation, there's a very strong focus on those with greater needs and mitigating the impacts of disadvantage. Anne was asking me earlier where the balance of efforts going, and this government was very much focused on probably 70% effort on those with greater needs, 30% on the rest of the population. So the strategy and its actions reflect that focus of trying to address the greater needs first, and addressing inequity of outcomes for children and young people. You'll also see on that slide some underpinning principles across the bottom of the page, and that's really the things that we heard about the way that people wanted government to work to affect change, the principles that should guide ways of working. So things like that children and young people are taonga, which means it's a Māori word for treasures, that all children and young people have inherent mana and dignity and rights. There's another principle there around how children and young people's wellbeing is interwoven with family and whānau wellbeing. Whānau is the Māori word for extended family, and familial linkages to extended family. And so that it's a very strong theme in our work is that we can't look at the wellbeing of a child or a young person in isolation. We need to be working to improve the wellbeing of the overall family. So what the strategy does is provide a shared language and a shared direction for government effort. It's intended to be an overarching framework for all, to drive all government policy and action that affects and impacts on children and young people. And as I said, it also is written in a way that can be used and picked up by other sectors as well to align their planning, their business plans if they want to the framework, and to use the same principles. It was very much developed in consultation with children and young people. We engaged with around 10,000 New Zealanders overall, 6,000 of whom were children and young people, who told us directly what was important to them for wellbeing and what gets in the way. The strategy also has 35 indicators for measuring progress, and that was important. People wanted to know how you'll know you're actually achieving success. So these 35 indicators include at least 15 subjective wellbeing indicators, which are around children and young people's experience of life, not just administrative data from health or education or other sectors, but actually asking children and young people themselves whether they feel safe, whether they feel loved, whether they feel that their family is doing well, whether they feel included in a sense of belonging, whether they've had experience of discrimination or bullying, for example. So that's pretty much the strategy on a page. You might want to turn to the next slide, Anne. There's a few things. Okay, so yes, that one's good. The first strategy itself was launched last year, so it's less than a year old. It was launched by the Prime Minister, who's the minister responsible for it. I've talked about well, I didn't actually talk about the vision. That was very much this government's vision, that New Zealand is the best place in the world for children and young people. I've talked about the 9 principles to guide the way we work. The 6 wellbeing outcomes were the outcomes that were very much derived from what children and young people told us, and I've mentioned the indicators. Importantly, the strategy is accompanied by a program of action, which is what government's doing about it bit. There are over 75 actions and a further 100 and something supporting actions that are led by over 20 government agencies. So it's very much a cross-government effort, and each government agency is responsible for delivering on its action or actions. And there's collective responsibility of Parliament, of government, of the Cabinet, to deliver on the strategy as a whole. the minister. So in this case, the Prime Minister needs to report annually to Parliament on what's being achieved under the strategy, with the first report, a voluntary report next year, and a first official report in 2022. The legislation also requires that the strategy is reviewed or refreshed every 3 years, so that it can't become a static document. It can be reviewed and refreshed to reflect new and emerging needs. For example, COVID, which we didn't know about when we wrote the strategy just last year. I'll just talk briefly about the next slide. So one of the features of it is that it's high-level leadership from the Prime Minister down. There's also joint ministerial responsibility for many of the policy pieces of work under the strategy. There's transparency in that we need to report regularly to Parliament, annually in fact. So there's accountability to the public on what's being achieved and what's not. The Child Poverty Reduction Act, which is a companion piece, has 3-year and 10-year child poverty reduction targets. So it really has a long-term horizon. The Child Wellbeing Strategy, similarly, we've taken a long-term view. Many of the issues that are impacting on child wellbeing were long-term in the making, and they will take several years to address. But so we're working to that view, but with a focus on addressing the greatest needs first. The advantage of it from our point of view is it has served to get everyone on the same page in terms of government action. There's a lot of activity already, but this provides us with a shared framework and language for working together. We came up with 5 focus areas for ongoing policy work, and 11 months in, they're very much still our key priorities, and I think even in a COVID context, they remain really relevant. So one of them is reducing child poverty. Secondly, mitigating the impacts of socioeconomic disadvantage. Thirdly, we heard a lot about the first 1,000 days and the first few years of life, and how we needed to have a more preventative approach to ensure that children are thriving from the get-go. So that's a strong focus of our work. Addressing racism and discrimination is very much a new area of work for government. We've never had a cross-agency work program to address racism and discrimination before, but it came through very strongly in our engagement that many children and young people were experiencing racism and discrimination in many settings in their lives, including in schools. That included bullying as well. Finally, extending whānau-centred approaches to improve child and youth wellbeing. That means working, as I said before, not just with the child or young person in isolation, but focusing on the family or the whānau as a whole, and working to improve the wellbeing of the whole whānau in order to improve the wellbeing of the child or young person within it. The Programme of Action is very much a living document. The strategy we've intended to create to last at least 3 years. The Programme of Action, the actions are evolving as we speak, and in response to COVID, of course. There's more information on our website about any of this, so it's enough for now, I think. I'm happy to answer more questions on it later.
Well, wow, Maree. I mean, that's a very short version of what is an enormous piece of work that you've been responsible for as the head of that unit for Prime Minister and Cabinet in New Zealand. And it's a very, I can see that it's a very complex, multi-layered approach. And there are many questions that we would love to ask you, but let me just ask one at this point, and that is, do you know of anywhere else in the world, any country that's done something similar?
Not quite. I mean, we did look around, and including, in Australia, there's some really fantastic work that's been done in different states in Australia. We've looked at the Tasmanian model. We've looked at the Irasi framework, as I told you. We also looked at countries like Wales, which has a legislation for the wellbeing of all Welsh citizens, and a wellbeing commissioner for the whole country, which is even more ambitious again in a sense. That's at the legislation level, with a range of different reporting requirements under that. we didn't find anything quite like what we've done at a nationwide level for children and young people. But yeah, certainly variations of our strategy in places, unusual, unlikely places. I think Uganda was one of them, which actually had some really interesting initiatives. But of course, the issues they're dealing with, include things like genital mutilation and, and famine and hunger. So slightly different issues to contend with.
So you've really done a scan of what was available around the world, and then created your own for the New Zealand environment. And as you say, there's excellent work happening in different places all over the world. But what's really stands out, I think, in New Zealand is how you've managed to get it in legislation, and it is whole of government. So those accountabilities across the different portfolios seem to be an important element there. I wonder, how hard was it to get that buy-in to make it whole of government?
Not that, actually. I should have mentioned the Irish strategy. That was the other one that was quite informative for us. I mean, they've done a lot of work, and their strategy's been in operation for around 6 or 8 years now, I think it is. So we had Skype calls with them to ask them what worked and what didn't. And one of the things was they had too many actions, and it was really hard, and too many priority areas. It was hard to advance on all fronts at all time. They'd kind of spread themselves a bit thin. I sometimes wonder if we've done the same, but we've tried to reduce down the policy priorities to a manageable number. In terms of buy-in, I think what was really helpful, just going right back to the legislation that is underpinning it, is that it got virtually unanimous support in Parliament. The legislation was passed with support by 119 of our 120 members of Parliament. So that was a huge affirmation, I guess, of the importance of all governments thinking about child wellbeing and reducing child poverty, and a real acknowledgement that meeting children and young people's material needs is only part of the solution, that we need to be thinking about wellbeing in a more holistic sense. We need to be paying attention to their social, educational health, mental health, emotional, spiritual needs. We need to be giving them opportunities for voice and participation. We need to be looking to the broader environment in which they are living as well, and the health of their environment. And we need to be giving them opportunities to live productive lives, and so that training and development and support for transition from childhood to adulthood is all part of it. So that definitely helped. And then I suppose leadership from the Prime Minister and collective cabinet responsibility is the next thing.
Well, I guess that would help. That would help to have that leadership from the top, but it's not always easy to get that whole of government sort of effort. So, Maree, as you mentioned when you were talking earlier, in a way, I think you were well placed to meet the challenges of the pandemic because you already had this framework in place, that you'd already spent quite a bit of time thinking about what children and young people and their families need, and then you were able to build on that during just trying to work out how to respond during COVID-19. So what have you found about the impact of the pandemic on children and young people in New Zealand, and how have you gone about identifying their emerging needs, and how are you responding?
Well, the first thing I'd say is that, of course, identifying and trying to anticipate the needs of children and young people is incredibly important because of the potential lifelong impacts that negative experiences now might have on their well-being. So probably like many countries, we looked around at the experience of countries with previous pandemics or national emergencies, what the evidence showed had happened and had been the impacts for children and young people. So our researchers were, very quickly put to work to mine all the research that's been done internationally on previous similar events. We also had the more recent experience of the Christchurch earthquakes here, and a lot of work that had been done post the earthquakes to identify, what had emerged in terms of the needs of children and young people. One of the things there that emerged was that children that weren't even born yet during the earthquakes have exhibited higher levels of anxiety and stress than earlier cohorts. So that's, an interesting finding in itself. At the same time, we were getting emerging insights from our frontline practitioners, from social workers, community providers, frontline workers. Plus, there were lots of pulse surveys, as I'm sure they were in Australia as well, of households and New Zealand of young people themselves about, during the lockdown period, particularly about what was going on for them. One of the positive findings, I guess, from a nationwide household survey, we had some input into the questions, and we wanted to know to what extent households felt they were able to support the wellbeing of the children in those households during lockdown. And all but 1 or 2% felt that they were well able to help support their wellbeing. They were quite positive about their ability to do that. On the same survey, though, one of the perhaps surprising findings was that of all the age groups that were asked, from 15 years up, young people from 15 to 24 were the most likely to identify that they felt lonely or isolated during lockdown. I think we might have anticipated that older people might have felt most lonely, and there's a lot of effort going in to do, telephone trees and outreach to older people who are living alone. But in fact, it was younger people who were suddenly unable to have face-to-face contact with their peer support groups, with through school closures and the restrictions on all movement and sports and social life. They identified that they were the most likely to identify that they felt lonely or isolated during that time. It was another finding was that, again, perhaps not surprising, we had concerns, again, based on previous pandemics, that there would be increased risk of violence in homes under pressure, that children might experience or witness, or family violence or abuse in the homes, and there'll be fewer eyes on the children, and without access to their normal, again, support structures and ability to go to school or tell someone else about it. What we found was that reports of concern to oranga tamariki did fall during the lockdown period, which for us was several weeks, and compared with the same time last year. And it's a little bit early to say whether those reports of concern will now change, that the numbers will now increase again. But there's emerging evidence that actually they're getting more reports from the education sector now that school's back, that teachers and others are able to see what has been going on for some children, unfortunately.
And you've got a lot of measures in place to support families from a financial perspective as part of your response as well. Would you like to tell us a bit about those?
Sure. So there's been a really strong focus from the outset. I think even before we went into lockdown, the government introduced an increase to core benefit rates to support very low-income families, and at the same time an initial wage subsidy for employers to help retain people in jobs, including families with children, of course. And introduced a rent freeze for 6 months to help ensure that people could still stay in their rented accommodation. So there's a very strong focus on kind of helping people meet their material needs, and that level of support was increased again and during the budget in late May, and there are a range of different measures to support people housing costs, with loans if they were a business, and further increases around things like winter energy payment assistance for low-income people, a range of income support type things, accompanied with a really strong focus on outreach, usually provided by community organisations and sort of trusted providers to provide practical support, whether it was food supplies or emergency housing assistance. Basically, meeting people's essential needs in that first phase. The other thing that government invested in very quickly was the social sector, to try and ensure that social service providers had the capacity to meet what they knew would be increased social service needs, whether that was family violence related or other kinds of needs exacerbated by the stress of COVID.
So, Maree, you also mentioned earlier about some early evidence that perhaps some families are doing well in terms of, or report that they're doing well in supporting their children. I wonder if there's other things you'd like to say about other green shoots or evidence that I know it's early days still, and it's probably too early to be actually measuring outcomes, but are there some signs that you're on the right track or otherwise?
I guess just going back to the COVID thing, I think the fact that we had known quite a lot about what some of the barriers were to wellbeing meant that in a post-COVID phase, government was very quickly able to activate some of the things that was thinking of doing anyway, or was doing in a small scale way. An example would be free and healthy lunches in schools. So we knew, and principals were telling us that with school lockdown, some children might go hungry because they actually they rely, or their families rely on the child being able to, or the family being able to get breakfast or lunch at school. And there was already a small scale pilot or prototype of a government provided healthy lunches in schools program going out to, it was intended to go to around 21,000 children by the end of this year. At budget time, the government announced it was going to expand that significantly to 200,000 children this year to meet the expected increased demand and to address the financial pressure that's going to be experienced by many families. So that's an example of something that was, I guess, instigated by the strategy, but was able to be scaled up quickly because the thinking had already been done. In terms of other green shoots, one of the responsibilities of our unit is to kind of monitor the implementation of the strategy, including the program of action. And although the strategy has been in place for less than a year, as I say, mostly agencies pre the onset of the COVID pandemic, were on track to deliver on all the things they said they were going to do in the time frame they said they would. With the, I guess, the 2 or 3 months that agencies have been scrambling to deal with the immediate impacts of COVID, some of those timeframes might be pushed out a little bit, but then some things have probably been expedited as well. And I guess the food in schools is one of those. Another thing that we knew as an issue was digital connectivity, or access to IT. One of the things that schools did very quickly with the lockdown was to actually supply, where it could, digital devices to homes where they knew children didn't have them.
So a lot of very agile responses required in this kind of environment. Yeah. Was there something else you wanted to mention?
I was just going to say, in terms of child poverty reduction, one of the things that we are required to do by legislation is report every budget day on progress against the child poverty targets. And so there's a report on the Treasury website, actually on our website, which is called the Child Poverty Report. And it was prepared mostly before the COVID pandemic, and it showed that by the projections were showing that government was broadly on track to meet its 3-year targets for reducing child poverty. But in a COVID context, it's now too early to know what impact that have. So
Mm-hmm.
yeah, a bit of a question mark there now, but
Sure.
it's something we'll be obviously looking at pretty closely over the next year.
Well, that's right. As I said earlier, there's still a long way to go with all of this for all of us, isn't there? Maree, I'm going to have a look at some of our questions now that have been posted. So just bear with me for a minute. So one is about, from a practitioner, do workers focused on supporting children need to learn how to involve the family or how to work with children with a view of supporting children's well-being? So I guess this goes to the question that I had in my mind as well about, well, what is this strategy at this high level that we've been talking about? What does it actually mean for a frontline worker and how they're engaging with children and young people and with their families? So are there particular requirements for practitioners and support for them to work with kids in the context of their family?
That's a really good question, and I think I would say yes and no. It's not so much as an obligation, but an encouragement. But I think actually a lot of practitioners are ahead of the policymakers, and they've been doing it anyway. In a way, we were trying to capture best practice, and for Māori providers, they would say they've always worked in a whānau-centred way, both with the family and the child. In the education sector, there's a very strong focus now on the well-being of children as the sort of the central thing that what that education is about. Around the same time as we were developing the strategy, there was something called the Education Conversation, which was a huge national engagement exercise about the future of education. And when they asked parents and young people about what was the most important thing they wanted from the education system, it was the well-being of their children.
That's interesting.
So, yeah, that's right. In the care and protection sector, there are national care standards which are very much aligned with the outcomes of the strategy. And there's actually a requirement for all children's agencies, chief executives, to develop an action plan to ensure that children in care or on the cusp of care are achieving the outcomes that are set out in the government strategy. So there's an alignment, a direct alignment to frontline work. I guess the other thing is that many of the actions in the action plan are directly for frontline practitioners, and a lot of new funding and investment which enables them and supports them to work in that kind of way. In terms of guidelines on actually engaging with children and young people, our Office of the Children's Commissioner is a really good source of best practice guidance in that. In fact, when we were engaging to develop the strategy, we worked very much with them and asked them to lead a lot of the engagement on our behalf because they're so good at it, and they've got a lot of best practice guidelines. Yeah.
And those actions you mentioned, for example, for frontline workers, they're all available on your website, aren't they? In terms of the actions under the strategy.
Yes, that's right.
Yep.
The program of
just
action.
in terms of alignment, there is another question here which is relevant, and that is, someone knows about your New Zealand's 10-year early learning strategic plan, which was apparently released in December 2019. And there's a question about what is the interface with that, between that strategy, the early learning strategic plan, and the wellbeing strategy.
So again, and it's a good example of a sector strategy which sort of goes in deep into one part of the child's well-being, and there are many similar strategies across government which reference the high-level outcomes that the strategy is trying to achieve, but that early learning plan is very much about what happens in those first 5 years of life. So they are.
So it's part of the overall wellbeing strategy. Is that how it fits?
It's referenced in the strategy as
Yeah.
is a way of taking forward, I guess, the high level outcomes and aspirations that government has. Yeah.
Okay.
It's very hard for all these things to really join up, but yes.
Just some questions here about outcomes. So, and it may be too early in terms of the progress of the strategy, but someone's wondering whether you've been able to detect an impact on reducing child protection numbers. That I assume that's notifications or removals of children into out-of-home care. I'm guessing that's what that means.
I think it's probably too early to say and to ascribe any kind of change to the strategy itself. You know, as with anything, there are lots of moving parts, and Oranga Tamariki, which is our child protection agency, is in itself a very new organisation with a sort of a transformation pathway, which is at least you know, a 5-year pathway with the absolute objective of reducing the numbers of children either needing to come into statutory care, and it's only, you know, we're only partway into that process. I'd have to ask my Oranga Tamariki colleagues how those numbers are tracking so far. But yeah, certainly it's a work in progress. I mean, the strategy itself has only been around for 11 months, so what we've said generally about outcomes is that at a national level, it's going to take some time before we observe those kind of shifts. There may be shifts in pockets and, you know, for subgroups or regions, but to observe national level changes will inevitably take some time. So even our first evaluation of the strategy in 3 years is more about evaluating whether the strategy has been implemented as intended, whether there's evidence that government agencies, the core government agencies and broader government is aligning to the outcomes of the strategy and driving towards, you know, those outcomes in their own work. Whether other sectors, NGO, community sectors, business sectors, philanthropic sectors, for example, whether they are at all finding the strategy at all useful in their work, and whether there's some community-led practices that demonstrate the strategy in action. I think we could probably say a partial yes to all of those things, but it is early days.
Is it a 10-year plan? Just remind us. Is it a 10-year horizon?
It's actually, we're breaking up a little bit. The strategy has a life of 3 years. The government of the day can choose just to continue it, but it may want the opportunity to renew or refresh it every 3 years. That's in legislation that it needs to be reviewed or refreshed, and that has to be after engagement with children and young people and with Maree and with the Children's Commissioner as a bare minimum requirement. So what we've is we would do all of that and broader as well. We would do another round of nationwide engagement if the government wanted to refresh.
It's a 3-year plan that will then be revisited after 3 years. I have a question here from a researcher now. Where do you get the child-centric data from? So are you using multiple agency type data, or do you you have a longitudinal study there in New Zealand as well? I mean, can you say a little bit about where the data is coming from on children?
It's a really good question, and what we discovered quite early on, of course, is and we always knew that we have a dearth of data for particularly subjective wellbeing data for children, and particularly for under 15-year-olds. So the in the strategy document, if you're interested, I can't remember which page, but towards the end, where we talk about the 35 indicators, we talk about the data sources that we will intend to use to develop measures and get data to report against those indicators. Many of them are from our national surveys, things like the health survey, the general social survey, plus administrative data on things like educational attendance and a lot of our health stats avoidable hospital admissions, those kinds of things. Where we struggled with was in the subjective wellbeing space, as I said. So we have developed, in conjunction with the Ministry of Social Development, a new youth health and wellbeing survey, which was intended actually to be in the field in schools about now, but because of COVID and lockdown, it's had to be delayed. But that was asking a lot of the subjective wellbeing questions that we haven't had good ongoing data sources on. There are lots of one-off surveys and of children and some education-based ones, but they're not usually available at a national level. So this was an attempt to start a new series of data which would ask younger children about their well-being. We have some things like that. We have whānau well-being questions in our general social survey, but not much for under 15-year-olds. It's a work in progress.
So just on that, just a question from me about the fact that well-being is often a bit of a fuzzy term, and it can mean different things to different people. And I'm aware in a very diverse country like yours and ours, where there are different groups of people with different cultural norms and backgrounds and norms and values. So values may vary a little bit from group to group. How have you dealt with the diversity in terms of coming up with this strategy rather than having to go down the path of different strategies for different groups?
It's an interesting question. We had a lot of discussions on this as we were engaging with different groups. And you're right, some groups thought that you needed a separate strategy, for example, for Maree children. But probably the prevailing view among Māoridom was that it was much more important to have a national strategy, a government strategy that adequately reflected the Māori Crown relationship and the unique status that Māori children have as tangata whenua, the children of our land in New Zealand, and that a strategy that worked for Māori children would work for everyone. So if we focused on what was good for Māori children, by extension, it would be good for most, if not all children. And that was the view that prevailed. And we, in terms of trying to reflect the different, different definitions of well-being and different dimensions of well-being, I think by being very clear that we were taking a holistic well-being approach, referencing the Indigenous cultural frameworks and cultural well-being frameworks we already have, and they are referenced in our strategy, and all the dimensions, including the dimensions that aren't always so readily thought of, like the spiritual dimension, and Māori is the term wairua, which is even the translation spirituality is a slightly inadequate translation, but it's sort of about the essence and the life essence, which is beyond the sort of the material and the physical. And so all those concepts are kind of embedded in the framework of the strategy. We wanted people to be able to see themselves in it, and we worked quite hard on the language and to adapt it as we went along, and then check it back with those groups to see if we adequately understood what they were telling us. Yeah, I think that's what I need to say in there.
Okay, that's great. So there was a question also about how did you reach the 10,000 children, or it was 10,000 people, I think, and 6,000 children and young people, if I recall correctly what you said. How did you consult the children? What methods did you use? What strategies did you use to get engaged and get feedback? You've already said that you worked with the Children's Commissioner in terms of engaging with children. And the final question in that section is, do you think the strategy would look different if the department developed dimensions without consultation with children and young people? So it's flipping it to asking you to speculate, would it have been different if you hadn't have done what you did? So how did you do what you did, and would it have been different if you hadn't have?
We'll just answer the second question first. It would have been much worse if a group of policy people in Wellington had tried to develop it by ourselves. It was it added huge value to hear from and do authentic engagement with children and young people. So yeah, there were around 6,000 children and young people who engaged. We used a mixed approach from probably one of the most popular things was postcards to the PM. So the Prime Minister invited children to write to her directly on what was the most important thing for them for a good life. And she got around 1,000 responses, and she read them all personally, and she used social media to talk about what she was hearing, to show photos of herself reading them, to encourage more. It was that was very effective, obviously, and children could see that actually what they were saying, was being read at the top levels of government. It was very powerful. We also had a survey, an online survey of children and young people. We had lots of focus groups, and as I said, the Children's Commissioner, and worked with a lot of partner organisations to make sure that we were hearing from young people in alternative education and youth justice facilities. So our Oranga Tamariki colleagues worked with to make sure we had access to children and young people and voices that we don't so often hear from disabled children. We work with disability sector people through, again, the Children's Commissioner to make sure we were hearing their voices. So disabled children, but also children living with disabled parents, to kind of get a range of perspectives. The rainbow community, making sure we heard from rainbow youth and quite young children where we could. So working with schools and a lot of primary schools who did classroom activities to feedback that way. Yeah, a multimedia approach, I guess.
The very comprehensive approach. So I'm just having another look at the list because we're starting to run out of time now. There are some questions here about young carers and about young people generally in terms of support, particularly through the pandemic. Are there any additional things you'd like to add about youth and or young carers as a particular subset of young people?
In New Zealand, there's a carers strategy that has been developed, and we've been a little bit involved in that, but it's not my kind of real area of expertise.
Sure.
We know that there are real issues for young people who often need to leave school to care for older relatives. Is that what you were meaning by young carers? Yeah.
Yeah, or they don't have necessarily always leave school, but they are responsible for caring of adults in the home.
In terms of youth-led activity and in the COVID environment, we saw amazing examples of that from pretty much from the first week, where school groups were doing kind of online support, kind of networking with each other and reaching out to those they thought might need a bit more support, to a lot of the frontline kind of delivery of food packs and things. Sort of student army type groups, but also young gang members, the people that you wouldn't have necessarily expected to come forward were absolutely the most appropriate people to reach the hard to reach, and they many of them mobilised without too much prompting and often off their own back, actually, to do what needed to be done. So one of the things that government's trying to do is actually learn from that and build on that and actually support those people have shown real leadership in their communities. There's a lot of new investment into communities, sort of the informal, non-traditional providers, I guess, to actually say, well, what else would you like to do? You've shown great leadership. We want to actually support you to do more of that kind of thing, if that's what you'd like.
Okay, I'm going to finish up with one of our listener questions, which really goes to that piece about where are we putting our money? Where are we investing when it comes to children and young people? And often, because we have to, we're often investing at it quite late. We're reacting late with our child protection system, because it's necessary to do so. But the listener is picking up that what you're trying to do is turn the dial to investing in more prevention, more upstream prevention and early intervention. Whether you have any comment on how that's being achieved, that shifting the dial upstream, to what extent has it been achieved, and how did you do it?
Great question. I don't think we're there yet. I think ever since I've worked in child and family policy, we've been talking about doing this. I think we've got a better opportunity perhaps now than we've had before to achieve more step change in this regard, and certainly a government that's very much focused on shoring up our core universal services as our frontline kind of investment, whether it's the early childhood education sector, the health sector, or family support generally. There's certainly a lot more investment going in, but we certainly still have a huge, much more investment going into, hard-end remedial activity, and that's not where we want to be either. So it is a work in progress. I talked about the transformation path that Oranga Tamariki's on. It felt in the first couple of years it really needed to shore up its statutory services to get its care and protection and youth justice system and its transition services, so that's the services for young people exiting care, to improve the quality of all those things. And then it was the next phase was to focus on intensive intervention at the to avoid those who are on the cusp of needing to come into care needing that care, because they would be they would receive the support from non-government providers, adequately supported to stay well, and to have their whānau or family supported to keep them at home. And then the next phase to early intervention, which is where the focus is at now. So it's a work in progress, but that's definitely the intention to get much more of the investment upstream. Whenever we look at our investment across the life course, so much more of it is in remedial responses and in the later part of the childhood years rather than the beginning.
Well, Maree, time to give you a rest now. You've done a fabulous job fielding questions from right across Australia, and often we find, internationally, I'm told later, where these people were joining us from. So you've done a great job. Thank you so much. And we'd love you, if you were willing to, when you come to our conference in June next year in person, if you could give us an update a year down the track. You'll have more data and more stories and more insights to share. And we very much look forward to welcoming you in June next year, face to face, we all hope. In a year's time, we hope we'll be able to do that. So before we let you go, I've just got a few final sort of housekeeping things to mention, and that's firstly, for everyone listening, there is a brief survey that's going to pop up when you log off, and we'd love you to fill that in. As we've mentioned, our conference is in June next year. You can already register on our website, and there'll be more information coming about that shortly. Last week we had a webinar, our first webinar with Richard Weston from Snake, and that's will be on the AFE's website if you missed it. That was a terrific session. And next week we have two webinars. One will be with the Youth Affairs Council of Victoria, and it will include some young people who will be joining us, and that's very relevant to, again, to what we've been discussing with Maree, and we'll be hearing from them about how COVID-19 has affected their lives. And then that's on Tuesday, and then on Thursday next week we have a session with Angela Lynch discussing how COVID-19 has been impacting on people experiencing domestic violence and the services that are trying to help them. So two very important sessions next week. So again, Maree, thank you so much from all of us here in Australia. It's been a delight as always to have a chat with you. And we wish you all the best with the next steps with your strategy, and we'll be watching and listening with great interest to keep learning from you as you go forward. Thank you so much.
Pleasure. Thanks very much, Anne. Thanks.
Okay. Bye, everybody.